We are the Akatsuki, Team 9, consisting of members Sam, Corey, Upar, Kevin, and Jonathan.
Current GRTC data from March 2020 indicates that there are routes with 20 to 30 passengers on a 38-seat bus. This means that proper social distancing of 6 feet is no longer possible. The problem we've identified is that bus transit systems could have a better COVID-19 response protocol.
Our solution is to use GRTC data to determine which routes are too busy and allocate bus resources accordingly. Our data dashboard would keep buses from overcrowding and in turn reduce this potential risk.
After we decided on the transit idea, we went looking for some data. We went to GRTC's website and we basically found ridership data, so how many people ride the bus at given times. And then we found stop data, so what stops are where, what time they stop at in 2 different places. We took both those data sources and then came up with the red, yellow, green ranking system, which basically ranks red is, quote unquote, unsafe times to ride the bus, and then green is safer times to ride the bus. And so we took some other data based on how popular things are at certain hours, what routes are more popular, and we merged all those sources together and basically come up with a dashboard that recommends effectively red times, which are times you should probably put more buses into service so that you can probably meet higher levels of safety, and then green times, which are times that are relatively safe to begin with. So that's how we made the dashboard.
Given that exposure to COVID-19 guarantees a worker cannot work for 2 weeks, we see a $961 loss of income based on a $25,000 yearly salary. This isn't even accounting for longer-term illnesses, cost of healthcare, or loss of opportunities. We estimated that roughly 12% of Richmond City residents use GRTC bus lines. The current rate of infection in Richmond City is 14 people per week. In turn, this means that 2 GRTC passengers may contract COVID-19. So each week, the communities reliant on GRTC bus lines lose income totaling $1,922.
The Virginia Department of Health reports disproportionate COVID-19 cases in the Black and Latino communities. Black 41.2%, Latino 33.7%. Of these, the areas in Richmond with the zip codes listed within these median household income ranges have the highest reported cases. Referring back to the income data for GRTC passengers, this aligns with the demographics of people who are reliant on GRTC for transportation. Therefore, to better serve the communities who are at the most risk for contracting COVID-19 and who are more likely to be essential workers, it is imperative that we minimize this risk by improving social distancing practices on public transit systems such as GRTC.
In summary, getting access to more data to serve new features will let public transit operations leaders make better decisions.